Sir, I think we can start the session.
Yeah, this time for us to start, ma'am. Yes.
Good evening, everyone. Welcome to Vayomanasa Sanjeevani Monday webinar series. Today's topic of the day is preventing hearing loss and promoting preserving hearing in elderly. To talk about this, we have Professor S.P. Goswami. I welcome Professor S.P. Goswami to the session. And today's moderator for the session is Mr. Janganathan. Monday webinar series. Today's topic of the day is preventing and promoting.
Ma'am, you are mute.
Preserving hearing in elderly. One second, sir. Some technical glitches is happening. So, 1 second. Professor S.P. Goswami to the session. And today's moderator for the session is Mr. Janganathan.
Your audio is not clear, please.
Ma'am, your mic is mute. Madam.
Yes, sir. It's some technical glitches happening. Please wait.
Yeah. The YouTube and this is getting merged. That is the technical glitch, ma'am.
Sir, hope now it is fine.
It is now fine, ma'am. You are now muted. You are unmuted.
Okay. Sorry for the interruption, sir. Okay, for introducing Mr. Janganathan, he is an active volunteer of VMS and he was a senior management grade officer with SBI and was retired in 2008. And he is actively volunteering all the senior welfare activities. I welcome Janganathan, sir, to the session. And I also welcome all the YouTube and Zoom participants to the session. On to you, Janganathan, sir.
Thank you very much, ma'am. Am I audible, ma'am?
Yes, sir. Yes, sir. You are audible.
Okay. So, good evening. Namaste, and ladies and gentlemen. Dr. Goswami, sir, resource person of this evening's interaction. Team from Vayomanasa Sanjeevani, a warm welcome to all of you for yet another webinar being thoughtfully organized by the Geriatric Department of National Institute of Mental Health and Neurosciences, shortly known as NIMHANS. This department is being headed by Dr. P. Sivakumar. He has taken a lot of initiatives to create awareness to senior citizens on health matters, and these webinars are one among them. It helps us to spread knowledge to people living all over the country and at times abroad also. Thanks to efforts of Dr. P. Sivakumar and his team, we have today amongst us Dr. S.P. Goswami, who holds a PhD in speech and hearing, also PGD HRM, and MBA in healthcare management. He is the first speech and hearing professional to receive the prestigious C.V. Raman Fellowship from UGC, Government of India. As visiting scholar, he is also a visiting scholar of Applied Health Sciences, Department of Speech and Hearing Sciences, University of Illinois, USA. After his work in various capacities, presently he is working as a professor and head of Telecenter for Persons with Communication Disorders in All India Institute of Speech and Hearing, shortly known as AISH. He has more than 22 years of academic, clinical, research, and administrative experience. He was in the area of aphasia, aging, neurocognitive communication disorders, and presently serving as President and as Secretary General of Alzheimer's Related Disorders Society of India. So I think to talk about this speech and hearing and how to preserving about this, I think we cannot get a better speaker or a better resource person than Dr. Dr. Goswami. So, I mean, I invite him, I welcome him for this webinar, and I do not like to stand before him and you to hear his beautiful explanations on this subject. Thank you very much, sir. Thank you. You are welcome. And one thing, only one word I like to add is that, I mean, normally the protocol that we follow is that during you can continue, go on with your speeches, sir. Whoever has got doubt, they can raise it through their, I mean, in chat, or they can wait till at the end of the session. Kindly give us some time so that the various concerns of the people can be addressed by you, sir. Thank you very much, sir. Please, the stage is yours, sir.
Namaskar. Thank you very much. I'm basically Goswami. You can call me Goswami. That's a better way of calling me. So I want to thank each one of you for present, and also the NIMHANS for giving us this opportunity to talk. What I'm going to talk is, I'm going to talk certain philosophy and certain things which are not aimed to hurt or harm anyone. These are all made basically to make the things little more clear. Okay, so there may be, and wherever you feel that anywhere, if you need doubt, any clarification, if I am fast, you can please stop me, not an issue with that. So basically, I will just talk about how do we prevent, promote, and preserve, because this is a very important hearing. Let us say that whatever I am talking, if you cannot hear, definitely it becomes a vacuum. Okay, it does not convey any information. Okay, that's the beauty of the hearing. So hearing basically connects us, and it's a very important sense organ for us and sensory issues for us to be alert, to be active, and to be awake also. That's the perspective of the hearing when you look into. So when you assess about the hearing, I have been talking about, I'll just talk to you about certain philosophies also, and I'll just look into what are the priority trends and how important is that as an audiologist and speech language pathologist, this need is going to increase, and then I'll give you some sum up. So one thing which we all should understand is that by 2050, nearly 2.5 billion people are projected to have some degree of hearing loss, and at least 700 million will require hearing rehabilitation across the globe. That means, like, okay, all of you have become older adults. People like me may not have, but I will move into that stage. So all of us who are talking to you in these seminars, webinars, and all, will move towards this, what I call as, I don't call as geriatrics and all, I call them as older adults. We all will move into that. So over 1 billion young adults are at risk of permanent. So it's not only the older adults, but even the younger individuals are also at risk. And avoidable hearing loss due to unsafe listening practices. This is what everyone is talking, that we need to have a safe listening system. Now, with the globalization, with the change in the technology, I think the listening has become unsafe for all of us. The loudness is 24/7. Anywhere if you go, especially in countries like India, whether even when you go to the rural places also, you will find that there are more number of motor vehicles. So there is a noise everywhere. In older adults, it has reported that 1 in every 3 people between the age of 65 to 74 years have hearing loss. That means anyone who is between 65 to 70 years have some degree of hearing loss. It may not be impacting, but there is a. And half of 75 years and above have hearing loss. That means everyone who is, I would put it into a very simpler term, that anyone who is 65 plus have some sort of hearing loss. It may not be that impact. And it is also reported that it is third most prevalent condition among younger, older individuals. 33% of the population, world population above 65 have hearing loss. That means the number is quite high and it is going to again increase. So in geriatrics, when you look into, I just have tried to put it into a very joke way, more lighter way, memes. So said wife says, I think you need a hearing test. So this is what happens when you don't hear it. So he will say, why the heck I need hearing test? So when clarity is not there, you might misinterpret something. Shall I make tea for you? Why the hell I should tea? These are quite funny, but quite common. Sometimes these are funny, but it is very common and these are disturbing. These can lead into some sort of conflicts also. So when we have a hearing, good hearing, it brings a change in your quality of life. Now people have moved out of life. So life we are not looking into. It is the quality of life. And then from quality of life, we have moved to life satisfaction index. That do I enjoy? Like say, for example, all of you are listening or come here basically in terms of your satisfaction. That, okay, I enjoy listening to this. I like this. So it's not the life. It is the quality of life and the life satisfaction index. So hearing is very important in terms of development. That is when a child is there, from child to declining of various skills. Because if someone is having a hearing skill, his activity and participation in the society can be disturbed. The severity, the extent to which it gets disturbed may be different, but it differs. Plus, it can prevent certain decline in terms of, you would have heard about memory loss, what we call as a dementia. So it can prevent, if someone is having a good hearing, he or she will get stimulation from the environment. So there is one model which they have been talking about. What we say always is, there are basically one model which talks about acquisition, okay, like child achieving that late teenage. There you will say for pursuing their goals. Then responsible stage lays 30 and early, responsible for societal system or social movements. Then executive, like people who are there in 50s and all. Biological and cognitive will lead to greater selectivity, like all these officers and all, whoever are in the government sector and all, from 40 plus onwards. Reorganization, late middle age. We say at 60 we retire. And then we use our energy in a more meaningful. Then reintegrative stage. So for example, you all will be following from 5 to 7 stages. Someone might have been retired, someone might have been legacy. Okay, so what happens? All those things revolves around hearing. If the hearing would have been bad, definitely one or the other stages might have been disturbed, or we would not have been able to achieve, or we may not have been so active, productive in our society. That's possibilities there. So it is very important that we preserve our hearing, we promote our hearing, we protect our hearing at the highest level, or we take appropriate measures in case if we have. So hearing loss, when we say, it's an individual loss abilities. Okay, to hear either in one or in both ears. Sorry, I had made a mistake. It's not ears, ear. Severity of hearing loss may be from mild to moderate. That is more than 25 to more than 90 dB. That's the loss, depending upon what is the severity. So it can be caused due to age is one of the factors, because as all of us grow, there is a change in our system. So when change in system occurs, definitely hearing also gets affected. Noise is another one reason. Disease, like any communicable, non-communicable diseases. Lifestyle we have been talking about. It may not be applicable for you people, but younger generation, lifestyle can be changes. Listening to music at a louder, lower level, or honking, all those things. It can also run into families. And then there is also one reason what we call is a polypharmacy. Like almost all of us, we use Ayurveda also, homeopathy also, allopathy also, or we will go to a shop and we'll say, okay, give this medicine, give that medicine. Polypharmacy, multiple medicines, when they use it, it has an effect on your hearing also. What can be the signs? Signs can be, some people have hearing loss without realizing. Okay, that they have a loss, but they don't realize it. They are able to adapt, adjust. People can have trouble in hearing over telephone when I call them. find hard to follow conversation when 2 or more people are speaking. Like when there is a little bit of 2-3 people are speaking, they may not find. Frequent requests to repeat the conversation. What did I say? What did you say? Increase the loudness. And very common complaint what comes from grandkids or the kids is that they use television at a louder volume. May often raise the loudness level of their own voice. Sometimes the loudness can increase it because they don't get a feedback of that. Have often problem in while there is a background noise. When some sort of noise is there, they fail to understand. Sometimes they will feel that someone is mumbling. Hard to understand voice of especially of women and children because that's a low pitch. Low frequency, they may not be able to appreciate. Difficulty in understanding while in noisy environment, such as when you go to a restaurant or railway station, they find it hard or they have to ask again and again. Sometimes this individual may also complain of ringing noise in the ears. Usually hearing loss, when you look into, these are of 2 types, broadly 3 types we put it. One is sensory hearing loss. This is basically damage to the nerve because we have one nerve. As the age advances, there can be weakness of it. Or there can be a conductive hearing loss, which can be due to a middle ear infection. Like someone might have infection in the ear. So pus may be coming, okay? Or mixture of both. Conductive hearing loss also, and there is a degeneration. So damage to the nerve can take place due to aging, okay? Or other factors, like there can be different factors. Age-related hearing loss, what we call as presbyocusis, it occurs due to change in the inner ear and auditory. So the nerve gets started degeneration, start functioning at a lower rate. What can be the impact? Impact can be, it is hard to establish conversation with family and friends. Difficulty in understanding doctor's advice. Doctor would have said it, you have to take medicine twice. They would not have heard because he would have said it at a very faster pace. The person would not have heard. Responding to warnings, like some vehicle is coming, some fire has taken place. Sometimes they find it difficult to respond to the doorbell and alarms because they have not heard it. It can affect their communication and speech. It can also affect the cognitive skill of an individual because that's how we get a stimulation from the environment. Adults with hearing loss have much higher unemployment rate. Okay. Among those who are employed, a high percentage of people with hearing loss are in lower grades of employment compared with general. I'm just talking about when someone is having even younger individuals. There's a discrimination. So when a person is having a hearing loss, he also gets a discriminated because he does not understand what he or she is saying. So then the conversation will not take place. Social isolation, loneliness and stigma can be. Impact on society and economy. Like once your hearing is good, you can do, you can speak, you can convey, you can express your views. And this is called as effects on years lived with disability and disability adjusted life. Sometimes because of the hearing loss, the impact is there. There can be disability also. That is when the percentage of hearing loss is more than 57 dB in both the ears. There are several issues which happens in geriatric population or older adult individuals, which can be prevented or can be avoided. Like we call it as abuse. Some sort of abuse is there. Now when you look into, because older adults are more vulnerable population. So what happened? The abuse can be from the formal or the informal caregivers. So if a person can hear, definitely he will know, definitely the informal and formal caregivers will not abuse them, right? They will be careful about that. So this abuse can lead into, it can be either physical, psychological or a material injuries, or it can be any unnecessary distress. Why I'm trying to talk about that there is a there is good number of people who abuse elderly people, both who provide services to them. Okay, even including caregivers. There are people. But if the person cannot hear, definitely the severity of abuse will be. But if a person can hear, the abuse will come. There can also be in terms of like abuse can be in any form also. And also there is some sort of material abuse, which like you would have heard about several times, that people misuse in terms of property, in terms of finances, in terms of fraud. All those things are material abuses. People might misuse it. And there have been also cases where there can be physical abuse, sexual abuse, or psychological. But if the person's hearing is good, the other person will be very careful. Okay, that he or she will be very careful that, okay, this person is hearing what their intentions are. So what I'm trying to say is, if the hearing skills are good, and there are two ways of hearing now. So let us say someone is having a good hearing, okay, and the husband is having a good hearing, but wife is not having a good hearing. And some sort of abuse is happened to a person who is having a good hearing. But when he raises the alarm, the other partner does not hear, the wife does not hear, the kids don't hear it. So it is important that hearing is good for in the environment as well as those individuals. So we can avoid, these are also preventive forms. There can also be neglect. Sometimes it has been reported that there can be unintentional neglect from the caregiver. Like he cannot fulfill the needs of their parents. The reason can be anything, like his intention is not to harm, but it happens. Like he would have been abusive. He would have pushed. He would have used a harsh word. Intentional is caregiver consciously or fails to meet the needs. Or unintentional can be because he cannot be able to afford it. So intentional can be when someone does intentionally to hurt or harm the needy people. So it can be in psychological, physical, or material. Self-neglect, sometimes person themselves avoid it. Okay, that can be due to several reasons. But what happens if the hearing would have been good? If the person can hear well and can say well, definitely the other person will be careful about it. It can be avoided. Then the biggest thing, like whatever happens, theft, burglary, physical assault, okay, all those can be avoided if the person has got a good hearing, because someone whose hearing is good, if someone shouts, they can raise that up. So other like crime and against geriatrics can be preventable. Like several times we say when the dogs bark at night, it's an indication that there may be some antisocial element. Some thief might have been there. I think you people know better than me. Breaking of the doors. When someone has got a hearing loss and someone has broken a door, they have not heard it. Then they come face to face. Footsteps of the thieves. So you could not hear it. Someone could not hear it. Knocking of the door. So nowadays, I think the crime has occurred like this. They knock the door and check someone is there or not. But someone has got a hearing loss and he has not heard. They're pushed them. Chain snatching. Why chain snatching happens? You would have seen several times that two older adults might have been going, but one would not have heard that someone has screened it, or it could have been visual. Road accidents are very common. This can be, and you would have heard about this Arushi murder case also. Still, there is a mystery. They are telling that, okay, parents are saying that they could not hear because of the AC. My perspective is that sometimes if some unwanted antisocial element has entered in a home and a person cannot hear, or if he could have heard, definitely things can be averted. This is my understanding. Health risk. There are several health risks which happens in elderly individuals which can be preventable. Like fall is very common. Fragile, weakness, fractures. And nowadays we also look into the family fallouts. The fatal health conditions like cardiac arrest or the brain attack can also take place in these individuals. But let us say someone has fallen in a washroom. Wife has fallen in a washroom, but husband could not hear. Or someone has got a heart attack which other person could not hear, because now we call it as, because of this globalization, the privacy, only husband and wife are there. at home. Most of the time, kids are away. So if the other person is not able to hear, it might delay. So major cause of health risk, whatever fall, fracture, fragility happen, it can be prevented, provided timely medical services were provided. And if the hearing loss would have been good, definitely the impact of these things would have been minimized. There have been several times there are family fallouts. Because one person is not able to hear, he or she communicates. So there is a communication gap. There are good, I have been working in this area. So I know there are several times, just because the person is not able to hear, just because the person's communication gaps are reduced, there have been a family fallout, even at the later stages also. And this incidence is going to increase. For your generation, it may not be impact, but now coming generation, what we call as these are the technology eras, there are going to be certain issues. Sadhguru said it, if you can read this. So they say, young people are doing their best to lose hearing. Use because of headphones, mobile phones, type of sound they listen, the hard music, volume at which they listen. We must create awareness to preserve them. We need to change lifestyles. So maybe with your kids, grandkids, we need to say that listen to everything, but there should be a control. We must hear entire our life. It is important. That's what Sadhguru says. And what is around us, ugly things in the world. Okay? In the world, but far more meaningful, so far more beautiful things to be heard. There are ugly things, but there are more beautiful things in this world to be heard. And that can be heard, that can be appreciated only with the good hearing. You can appreciate the music, you can appreciate the ragas, you can appreciate when you go to temple, church, you can appreciate that. You can appreciate conversation with your granddaughters, grandkids, with your friends. So there are good things in this. So all those things impact basically when you look into, these are three things. What can happen? Hearing can have an effect. It can change due to biological systems. It can be due to the physical. It can be due to the psychological or the sociological factors. All these factors, we always try to see, I'm not talking from a medical model. I'm talking from a biopsychosocial. Biopsychosocial model is basically it will look into the impact of biological system due to what we call as the environmental and personal. Like all of us know, age is a continuous process. It keeps on increasing, right? So when it increases, there can be certain wear and tear in the system also. Sorry, one second. So there can be biological things can take place. But what happens whenever there is some change in the biological system, our activity and participation. Let me give you a very simple example. Like when someone is having a headache, right? Simple headache. So when we have a headache, we are not that much active and participation, right? Our activities, we will not be that alert, we may not be that good listening, or we may not be involved. So simple headache can create uneasiness in the environment. So when someone is having a problem in the inner ear or in the middle ear, his activity and participation, meeting with the friends, meeting with these well-wishers, going outside can be disturbed in these things. But all those things can be changed or can be modified due to contextual factor, what we call as the environmental and personal factors. That is the attitude approach of the society. The environment is so good that we can listen. The personal factor, the motivation is there. I can afford, I can access. All those are in our hand. So there are certain things which are in our hand which can be modified and we can make use of that. So whatever happens, happens, but we can always improve our activity and participation in the society, provided our environment is good, socially, economically, emotionally, psychologically, which can always serve as a facilitator for that. And that comes through good hearing. Positivity, what we do. Polypharmacy is one thing which is a leading cause. Now it is going to be, okay. So basically what it happens is these are the toxic accumulations. It's like a pollution creating in the system. So when we create a lot of pollution in the system, it can have an impact on hearing. Second, what we have been reporting is non-adherence, medication non-adherence. It is good number of people who have got hypertension, diabetes, depressions, or epilepsy do not follow the medical guidelines. Like if the doctor would have said you have to take 3 times, they would have been taking only once in 3 days. They say today I'm fine, I don't want to take, which is very common. So that is not advised. So in case if polypharmacy, multiple combination of allopathy, Ayurveda and all we are taking, it is bad for the hearing also. And prescription over the counter, you take this medicine, that is not good for our reasons. Because some people will say, a lot of advertisements keeps on. So I think we should keep those advertisements away from. Someone will say you use Baba Ramdev ka, someone will say you use this. No, that's not good until and unless your doctor has prescribed. So we call it as that because of these drugs, someone can have hearing loss as well as ringing sounds can be there. Plus other issues can also be there. So one need to be very careful when you take too much of medicine which are not prescribed. So hearing and solutions, in case if someone is having under medications and all those things, so individual who are 50 years and above, who are taking medicine for antipsychotic or non-communicable diseases like hypertension, diabetes, or all those things, they should go for a hearing evaluation once they are 50 years. Because you can monitor it at that level, you know it. Annually for citizens above 60 years without any comorbidities, if they don't have any hypertension, diabetes, they are not taking medicine, please get your hearing evaluated. It does not matter in between now, because we know the baselines. Biannual for individual who are 60 years and under medication for antipsychotic and non-communicable disease, like you're taking medications. If you are 60 years, please get twice in a year. Individual who are 70 years and above, please get your hearing evaluation twice, irrespective, because earlier you get it, it is always better. And avoid having polypharmacy and non-adherence of medicine. Please take the medicine what is prescribed. Don't skip those things. So this biological system, which always I tell is that there's nothing happens in older individuals. People talk about degeneration, means I have a different philosophy. I always call them, it's basically your too much of information, because over a period of 60 years, you have acquired so much of information. So it is there in the brain. So people talk about, it's basically, it's like a traffic, road traffic. Like when you are in a city like Bangalore, you would have seen 30, 40 years back, the traffic was not so much, but now traffic has increased. Same thing happens in the brain also. When someone is 70 years of traffic, so much of information is there. So what happens? People who are elder, their speed comes down, because in the traffic also you cannot drive a vehicle at a speed of 60. You drive at a speed of 20, 30. Same thing happens with our system. So what we need to do is we need to bring down the pace of our conversations. So what we do, in case someone is having hearing loss, pace down the presentation, speak slowly, use alternative modalities, like you can use visual, you can use body gestures. Sometimes it has been reported that don't compare a youth with elderly individuals. He is like this. Their pace can be different, but elderly pace can be different. Have more anxiety than younger individuals, that is the report, especially when they have hearing also, and can be elevated using person-centered. So we always talk about that when you have, talk to your consultant that, okay, these are the issues. Nothing wrong in that, because we need to find a solution for that. Speak it out. The priority trend, what we see in the present system of our hearing is basically everyone is bothered about life. It has changed from life to quality of life plus life satisfaction. Visible plus invisible conditions, like hearing is a visible, vision is a visible conditions. Hearing is an invisible. Until and unless you see, It is until and unless someone presents a stimulus, the person might look fine. A person who is a blind easily can be identified. A person who is having a locomotor can be easily identified. Those are visible things. Invisible conditions are less priority. That is, hearing is a less priority. Correction brings more priority. However, if corrected, productivity improves like anything. So basically, when we look into the priority trends also, like any health condition happens, let us say someone has got a stroke or someone is having a stroke also. So stroke may what happened? First, they always look for survival. Then they look into, okay, that person can move out. Then we say, okay, can he go to wash? Then we say communication. Okay, whether his hearing is good, speech is good. Then we talk about cognition. So what happens? Priority, even in terms of priority trend, it is not at first, it is at a fourth stage, but it brings maximum productivity. It brings maximum harmony in the system. Physical or visual impairment less excluded from the society. People who have got physical, but people who have got more hearing or communication are more excluded because no one hears them. They cannot speak. And as a result, what we are trying to do is that this incidence of hearing is again going to increase in India. This incidence, because it is projected that by 2025, 158.7 million people will be there in India, all of us. And this incidence is improved because of better medical healthcare facilities. Survival rate has improved. So risk of having hearing is again in Indian population is going to affect, and this can bring a change in the quality of life. So we have been saying that if you look into our number, see, previously from 1901 to 1931, we had only 2 crores per year number of elderly people were added. But in 1981 to 2001, 10 crores were getting added. 2010 to 2015 crores. And by 2030, we will have 1.5 billion. And 2050, we will have 1.6 billion people. So 50% of our population will be elderly. So we need to preserve their hearing. We need to promote them because their wisdom, expertise, experience, skills need to be used at the highest level. So the current trend, when you look into, vision and locomotor is more accepted. Someone can come on the wheelchair, but people find it hard to use a hearing aid. Acceptance is low. We can use specs, but we find it hard to use the hearing aids. Number of persons using vision and motor aids and appliances is high, like from microscope to telescope. That's what happened visually. To specs, stick to motorized wheelchairs. Voice of person with visual disability is heard in the corridors, but corridors of policymaker as well as service providers. But people with hearing loss, no one listens because they don't understand, so no one cares for that. That's why our policies towards hearing loss are less compared to the other over disabilities. So basically, when someone is having a hearing loss, when someone is having the trend, when we look into, what we do is we basically look into that vision assessment. Almost all of us start going as early as 5 years, 2 years also. Hearing assessment, very less. And speech language, so we never go or even swallow. So what happens? We need to use it or lose it so we can preserve it. If we do not preserve it, it can have effect. And if the hearing is good, it will help into brain wiring and rewiring because you will get stimulations. Hence, it will result into uses of the expertise, the wisdom of older adult individuals. And this can bring a more positivity in the culture, the society, economic and family ties. Let me tell you, I'm not boasting it because all good families are tied up because of older adults. All good kids are due to older adults. These are thanks to the grandparents because they have time, they have experience, they have expertise. They can handle it. But young couples cannot handle it. Like I can vouch on each one of you that your connection with your grandkids will be too good because they like you the maximum and they'll learn maximally from elderly individuals. Provided you can hear what they said, and you can respond what they have heard. So that is the beauty of older individuals. It has been well established that hearing is, one second, what happened? That hearing, hearing is one reason which can affect which can lead to dementias also. So it can result into decline of cognitive structures. But if good hearing is there, it can stop it. Hence, it is very important for all of us that we preserve our hearing. So it is written as per this report, every person with 60 years plus must go for a hearing evaluation. It is must. It is the need of the hour. 1 second, sir, 1 second, give me one minute, because I think sorry, I don't know. Okay. So hearing assessment, basically when we do it using a qualified audiologist or speech language pathologist. Please ask him whether he has got a registration with Rehabilitation Council of India. Because so many times you will say that I do hearing assessment. There can be fraud too. We assess hearing from 250 to 8 kilohertz, and we do a detailed audiological evaluation. So basically when we assess it, look for what we call it as pure tone audiometry. We do a speech, we do a hearing imitance, we do autoacoustic, and we do auditory brainstem also, depending upon that. But before that, we always ask a person that go to an ENT doctor in case if there is an impact, if there is a wax or any other infections. If those infections or those things are cleared, then we go for a detailed evaluations. So this is how your audiogram will look into that. What is the loss? Okay, that is usually in older individuals, we will find that the loss is more into high frequencies than the low frequencies. Speech audiometry, which you check because to assess that, okay, whether they can appreciate what is being heard. It is not the sound, but the speech, which is very important for us, which is being heard by the individual, is very important for us to remember. We do impedance. This is basically to look into whether there is some problem in your middle ears. And then autoacoustic emission, basically it will tell you how good is your inner ear. And then sometimes when we find it, we are not able to get good results, we also can go for an objective test, but this is rarely done. But usually the testing will take not more than half an hour to 45 minutes to 1 hour, depending upon the person, for the assessment by a clinical audiologist. Then based upon the hearing loss, we prescribe a hearing aid. Please remember it that do not go for these advertisements. In the newspaper, you will get several advertisements that buy one hearing aid, get one. That's not right, because every individual has got a different need, demand, and want. And the hearing aid has to be prescribed specifically for that individual to meet their needs. It has to be programmed properly so that one can appreciate the loss, whatever has occurred, so that he or she can hear well and he or she can actively participate. There are certain myths about this. Some people say that older individuals cannot use technology, higher-end equipments or higher-end mobile phones and all. That is basically a myth. Our report has said that older individuals, whether they are literate or not, they are quite effective in using the technology, like how you have been using, provided they have good support from the family and it is a clinician managed. Literacy, knowledge of use of smartphone is not. With this background, we also have certain things what we call as disability certificate. Older individuals get old age pensions also. Plus, if they have got a disability, like if the hearing loss is more on 500, 1 kilohertz, 2 kilohertz, and 4 kilohertz, okay? If the percentage of hearing loss is more than 40 dB, one can get a disability certificate. Disability certificate will help a person to get pension, as well as certain privileges he or she can get, like when he makes a travel, or In case someone has misused or abused him, in the court of the law, disability certificate will play an important role. 40% should be the, and you can also get as a UDIDs. And there are different policies which state to state varies, but it is good to have a disability certificate in case someone has got hearing loss, which is more than 60 dB, and benchmark disability is to get 40%. Hearing conservations, how we can do it? We can go through regular hearing screening, treating underlying medical conditions like diabetes, hypertension. We need to avoid loud noise and exposures, avoid taking self-medications, which we call as certain medications, which are harmful to the ear, and we can use good assistive listening devices. Please remember that there are very good hearing aids which are available, which can hear you crystal clear, provided a good audiologist has provided, and he has understood your needs and demands, and then you can use it. Overall, promoting hearing conservation in elderly is essential for maintaining their quality of life and reducing the risk of cognitive decline, social isolation, as well as depression. Sometimes even individuals, when they don't hear, they might go into depressions. We have got a wide scope when we work with them because population is going to increase. We need to work for the quality of life, and we need to remember that we need to make these services accessible and affordable. Because all of you are elder, the services can be escalated if you can raise your voice. Remember, the glow of older adults can be increased with good family support system, environment, friends, and social networks, and which comes with a positive hearing. So to sum up, older persons should not just be treated for a condition or hearing, but I believe into that we need to connect, we need to communicate, we need to coordinate, and commuting their identity. Identity is the basic thing for individual with older individuals. So our approach, which that's what we are looking into, from smart to smarter we are moving into. We want to have a specifically designed approach, which can be measured, which can be achieved, realistic and time bound, that is smarter. Smart to smarter. We wanted to move into shared based approach, which can be monitored that, okay, how the hearing has changed. We wanted to accessible, that okay, services are accessible and affordable to older individuals, relevant to them, transparent, there is no ifs and buts, evolving. Any change it comes, we can make it change, and relationship centered. So it's basically, we always say that build a good relationships. But anyone can have differences of opinions, anyone can prescribe services, but having a relationship centered approach brings a lot of positivity, and that can be only with if you can hear well, if you can listen and you can understand and can provide a positive perspectives. This is the model which always I use it, and I always say that elder individuals would have reached to a self-actualization because they would have achieved all those things. This is the highest levels, but sometimes because of the hearing loss, their self-esteem might go down, belonging relationship might get disturbed, safety can be issues, and physical. So there is a possibility they might come back. But if you can retain their hearing, you can retain their self-actualizations, you can retain their identity, and you can make them, one can make use of their expertise, experience, and wisdom in the betterment of the societies. So I always report this. Elderly individuals, they always feel that my pace may be slow, but my participation, preciseness, promptness, punctuality, and performance will never ever diminish. This is the thing which always I tell that person with older individuals are more participative, they're more precise, they're more prompt, they're more punctual, their performance are always at above. We need to use their experience, wisdom, expertise, and patience to retain my identity. And all those things will come provided we have good hearing, we can communicate, we can connect, and we can respect them, we can provide the same dignity, identity with good hearing, and I hope that this can make a difference in their life as well as our life. So always this is one straw which I says, please let us not view the older individual as a liability, but they are always an asset. But they need to be handled with care. We need not to go, the younger individual I wanted to say, that we need not to put any pressure on them. They have lived and they have lived quite happily, and we need to respect for their participations. Thank you very much. Sir, if you have any queries, I'm open to them, sir.
Thank you very much, sir, for an excellent session. It was not, what we have been expecting is what kind of prevention that can happen, how to prevent it. So we have very categorically explained what are all the tests that we can undergo. And we have also highlighted about this polypharmacy, which many of us ipso facto do this. Therefore, this is a very, very preventable step, sir. So thank you very much, sir, for such a nice elucidation and lecture on this subject, sir. Now I invite participants to seek explanations. If they need any explanation on any point made by you, I would request them to ask the question, sir. Thank you very much.
Doctor, periodical checkup.
Goswami. Don't call me sir, please. Call me Goswami. I'm not so. Please.
Thank you very much. Periodical checkup for senior citizens above 70, 75, 80 like that.
Yes, sir.
EAT is enough, I think. Doctor or a specialist.
Sir, I could not hear, sir. You wanted to say that we need to go it or we need to increase the CVI? Sir, usually I would always advise that once you're 75 and all, please go binaurally. Like you always go for a master health checkup, right? Annually. I will just say use it every 6 months. Because there are two things can happen. One, I always say is when you go out, you have more communication. Like I don't think you belong to the technology eras. You people belong to an era of connecting face to face, not Facebook people. Right? So two advantages will take place. You will know it. But once it comes, we may not realize when it has happened. At initial stages, if we have identified, it's very easy to retain that.
Thank you, sir. Thank you.
Mr. Goswami, this PN Murthy here. I have one question.
Sir.
When you say it is, biannual and annual checkup, you see, we go for annual checkup, which doesn't cover the hearing test. Even the ENT doesn't, normally the annual checkup, the ENT tests are not included. At the most, eye checkup or a dental checkup is included.
Yes,
so
sir.
when you say annual checkup, we should specifically go for a hearing test. We should include hearing test also.
I would always advise.
Hearing, because most of the annual checkup, in fact, almost all the annual checkup doesn't cover the hearing test normally.
Yeah, I agree with you, sir. That's what I'm trying to say. You people are the voice. That's what I'm saying. People who have got all other hearing aid and no one listens. So everyone got a hearing loss. I think sometimes some of you might have been in good positions. Please raise this concern. Even if they have not written, it might cost some 100, 200, 300 rupees.
Yeah, that is right. Yeah.
Because it's better to have. Because you can avoid so many conflicts.
Okay. Thank you.
Also, sir, I would like to, you have been in your lectures, you have been talking about you are conducting tests or something like that at Mysore or something like that. Maybe a little, is there any other institutions in India who are conducting these tests? So that
there are private practitioners, a lot of people are there, sir. I can give you, my number is available to you. I'll repeat. In case anyone needs anywhere in India, please let me know. I represent my association. I will connect you. Okay.
That helps, sir. That helps.
9480. I will write it also. 9480.
You can put it in the chat, sir, also.
Yeah, I will put it in the chat also. The 9480-169216. You can leave a text to me. I will get back to you in case if I don't pick. And any part of the India, if you are there, you let me know. I will try my best to get you services.
May I repeat the number, please?
9480.
I will repeat because I have noted whether I have noted correct. 9480-169216.
Hanji, correct.
Thank you.
One question, Goswami.
Hanji.
Yeah, you mentioned something about drug. My name is Mani. You question about drug-induced impairment.
Yes.
Can you elaborate on that?
That's what I was. Drug-induced is polypharmacy. Multiple drugs when we are taking it. We take Ayurvedic, homeopathy, allopathy, plus what happens, certain drugs. Like we have been talking, autotoxic drugs are there. Especially the drugs, especially during this, we take what you call as steroids.
Diabetic.
Diabetic, high metal toxicities.
Okay.
So people who are diabetes, hypertension should always go who are 50 plus once in a year minimum, but preferably twice.
Okay.
Because once your record is there, then you will know, look, you need to go for an early intervention.
Okay.
Sir, my name is Nagaraj Rao. I have a couple of questions.
Kindly go ahead, sir. Kindly go ahead.
Yeah. Now, I have been practicing yoga for about 25 years. I feel very sure that some of the asanas like Sarvangasana in yoga has helped me in not only not having the problems of diabetes or the hypertension, but also my eyesight and my hearing also. I went through the cataract only now at 84. And there could be some hearing loss hereafter because I had some twinitis now and then, not in a regular basis. Second question, using of earphone at an early age, does it cause damage to the ears? Third, the two hemispheres of the brain, which of the two hemispheres of the brain respond to a better hearing? Can listening to Sanskrit slokas improve our listening feature? Thank you, sir.
Okay. If I have not understood, you are trying to say that will yoga help? That is one part. Second, you are trying to say whether listening to slokas and all will have an impact. And which ear we should use a hearing, our mobile phones? Is that question, sir?
No, not that. The first two are okay. I said usage of earphone. Generally, in the youngsters, we feel, we have found out that everybody who keeps on walking, it has come even into the elders also. They put on the earphone and then we keep on doing it. Does it affect the
yes.
ear?
Okay, perfect. Sir, yoga and all those are we call as wellness. What I'm trying to say is everyone is not prone to have hearing loss. But when we can take care of our wellness part, definitely our sensory system will be better. But what happens is now, because of the polluted environment, we are living in a polluted environment. I'm sorry to use that word because anywhere you look into it, everything is contaminated, starting from water to whatever we take it. So it can have an impact. But yes, wellness is always good. Yoga has an impact. Listening to slokas and all, it always help you to stimulate your brain, provided he or she has got hearing. It may or it may not have an impact. But as the age advances, there are changes in the brain which may not have much impact. That's one part. Headphones do create a problem. So always we say, always use a speaker. That will always help you because the more the closer you are there, more you are prone to the hearing loss.
The hemispheres, sir, left or right, which is
hemispheres are basically what happens is if you are using in the right ear, it will go to the left hemisphere. If you are putting into the left hemisphere, it will go to the right ear. So there is a crossover can take place.
I see. Twinitis.
Thank you, sir.
The other question was on tinnitus.
So tinnitus, yes, sir. Tinnitus is a ringing sound.
Yeah.
Sometimes you get a sound that can be due to hearing loss also, or it can be due to infection also.
Is it an indication of damage caused to the ear?
There is a possibility, yes. That's an indication.
Thank you, doctor.
Probably you will be able to get out of it by having a good test on that, sir. Yeah. I mean, we'll try to fix up somebody in Bangalore so that most of us can go and have a good hearing, I mean, test on this.
Sir, you tell me, sir, when you wanted to go, I will make sure that all of you get evaluated.
Yeah. Please tell us, sir. Please tell us.
Okay. I will share it with this, sir. I will talk to one of my colleagues. Okay, and I will tell them that all my people will be coming, so you have to do audiological evaluation. That way they can keep a record of you.
Yeah, that will be very nice of you, sir, because...
Yes. Sir, you give me a call, sir. I will share your number with them.
Okay, sir. Sure, sir. Sure.
Okay,
sure.
you please give me a call. This my number is there.
Hello.
Yeah. It's
when you want it to
sir.
go,
There's no
I
problem.
will arrange it and I will tell them to call you up.
Okay, sir.
Hello.
They are not commercial, but they are okay. But they do a good service.
Okay, so that's what we need. We need value for the money, sir. So although, I mean, these are all talks where we often avoid any of these, commercials. But anyway, this is one thing. The hearing aids and hearing audiology tests are not very common, sir. It's not very easily available. And I also get some calls from some companies. They say that you come for this audiology test, we'll evaluate your audiology, and then we'll prescribe or something like that. We really do not know how far to rely on them.
You are true, sir. You are true, sir. That's what I told you. You need to have someone with the registered people. Nowadays, everything in India, other than the audiologist, everyone is an audiologist. So I don't want any misuse or abuse to anyone.
Yeah, that's why we need your guidance.
So please tell me, sir. I will connect you back.
Okay, very nice, sir. Some other person was trying to raise a question.
Or in case if all of you can go together, or in case if you meet in one place, I can ask them that can you evaluate it?
So here, sir, the participants are from different parts of the country, sir.
Okay, no problem. Wherever part of the country you're there, please tell me. I will try to get in touch with some.
Okay, sir. That is nice of you. That is nice of you, sir. Sir,
am I audible?
Yeah. Rajendra Prasad, sir.
Yes. Can I speak?
Please, sir, go ahead. Please go ahead.
And you can speak in Hindi, Kannada. I know it.
Right.
I may not be very fluent.
I will speak occasionally. I am speaking from Hyderabad. I am a medical man with public health specialization. My age is 76 years. I am still working for an NGO. I appreciate sincerely the way you have brought out the topic. By carefully avoiding medical jargon and not going into anatomical and physiological details, you have made the subject very easily accessible and understandable to all the people. That is a very great achievement. I heartfully congratulate you for that thing. My concern with this thing is when the problem of hearing impairment is catching up and is growing in the recent years with the percentage of...
Sir, you are muted, sir.
Your voice went off, sir.
Sir, you are muted.
Mute, sir. Rajendra, sir, you are mute, sir.
He is out of connection, sir. Rajendra Prasad.
Jamunathan, am I audible?
Please, 1 second, sir. 1 second. Please go ahead, sir.
Is online evaluation of impairment is possible?
Sir, no, sir. Usually online, sir, it will not give you good result because we need to do in a sound treated room.
I see.
If the sound treated room, if you don't do it, then you will not get a clarity, sir.
I see. Oh.
We don't advise.
Okay. Thank you.
I'm trying to unmute Rajendra Prasad, sir, but he is not getting unmuted. He is not, he is also not coming for chatting. Anyway, we'll wait, sir. I think, hope, probably there is some connection issue, sir. There is some connection issue.
It happens.
Yeah. So that's what I said, sir. People attending these webinars are mostly from various parts of the country, sir.
Okay, sir.
That's why, see, one good thing about these webinars, sir, this is not at all a sponsored event, sir. There is absolutely no commercial involvement in this. In fact, totally it is, it's an extension effort by the Geriatrics department of NIMHANS. They are doing an excellent job in this, in the sense that they try to dissipate knowledge on various matters, sir. It's very,
Yes, sir, yes.
I mean, we are very fortunate that we are always getting speakers who are experts in that particular subject, and mostly from all India institutions.
Yes, yes.
So that's very nice of them, sir. In fact,
I usually work in this area, plus I work more with the stroke patients.
Stroke patients, yes, sir. That's...
Who has got stroke, who cannot, whose speech language goes, or any speech language problem. Anyone has got speech language hearing problem, please feel free to call me, text me. If I don't pick up your call, I'll call you back.
That's right, sir.
Don't feel bad. I will get in touch.
Excuse me, is ear picking is can ear picking be done? Ear picking. I used to use my some
earbuds, sir.
Earbuds.
Sir, earbuds
ear picking. Sometimes I used to do ear picking.
Ear picking.
Something else.
Yeah. Just, I mean, using something to find out.
Yes.
Yeah.
Inside
so
the
that
ear.
is not advised. Please don't do it, because sometimes what happened, whatever your wax is there, it might push towards your tympanic membrane and you might damage it.
Oh. So
don't do that.
Any drops we can do, we can apply.
Sir, usually we will not advise, sir. Usually human tendencies, it comes out. But in case, if you have not shown once, or you can get it done from an ENT consultant, it is always better to get it done from. Otherwise, damage is more dangerous.
Thank you,
Ear wax is there, sir. Waxolove and all, you can use it, which is softening. But show it and put it, because sometimes if there is a perforation and you put it, again it can have an impact on that.
So how can we use the ear drops, ENT drops?
Sir, ear drops are usually drops in the sense in terms of to remove the wax.
Sometimes I used to put drops. If I have.
Sir, for what purpose they are given? Whether you had any infections?
No, sometimes I used to have some itching sensation in the ear.
Sir, if they had given it, that may be for the itching sensation. That is there. Sometimes what happens? There is something like fungal formation can also be there.
I see.
Because of, so that in case if they are prescribed, you can use it, not a problem. Self-medication, don't do it.
Okay. Thank you so much.
My submission is self-medication, don't do it.
Okay.
Sir.
That is nothing but polypharmacy.
Polypharmacy.
Yes. It's a beautiful term you have brought in, sir. Polypharmacy.
I am
Rajendra, please come. So Rajendra Prasad has come back.
Yes.
Sir, next you can right, sir.
Yes. I have got 3 points to make. Number one is polypharmacy. Polypharmacy is not the doing or the mistake of the subject. It is the prescribing community, the doctors, who are indiscriminately going for larger number of drugs. They should exercise more caution in the interest of the elderly people. Number one. Number two, the government should also take certain steps to bring down the cost of hearing aids. To my initial knowledge, I am not deeply into this thing, but I have got some hearing impairment also. I have been avoiding to purchase one thing because I am still able to manage. Most of the people of my sort, they delay the purchase of and commissioning of a hearing aid because of the cost factor. Particularly people living in rural areas, people coming under low economic groups, it will be a Herculean task for them. The children will also be not inclined to support their elderly family, elderly members, father and mother or grandfather with this investment. That is, so government should take steps. 2 things are over. Number third thing is, one is polypharmacy, responsible to the medical community. Second is the governmental responsibility to bring down the cost. Third is the reason why people do not go for regular hearing checkup is the scarcity of authentic or reliable centers. There are several centers in urban areas, but nearly 50% of them, it is my personal opinion, are operated by not qualified people. So qualified people are there, people will go to this thing. And after mentioning these 3 things, I would like to make an appeal to whom I do not know, but there should be a wider dissemination of the information, and wider spread of the message that it is a manageable condition, it is almost a curable or treatable condition, and one has to really go for it. That message should spread into all areas. My personal perception is that message has not percolated down, it has not spread wide. Thank you.
Sir, I agree with your view, sir. One, that's what we said, sir. When you go to a doctor, you should always say that you have been taking these medications. I understand. Most of the times it is not being heard or not being known. So it can have an impact. Yes, I know the cost is high, but we also are trying through the government also that it should come under the purview of insurance. We are also trying that it should be a part of annual health checkup, wellness part. So that is submission to all of you. Sometimes I think all of you are well learned, you have certain connections. Sometimes you have to also raise your voice, write it, because all our politicians, we give vote to them. At the end of the day, because of us, they are there. So we should also raise our voice and tell them that, look, you need to do these things. Because sometimes when a professional tells, they think they have got some other agendas. But people like you who have got experience, expertise, wisdom need to do it. Third thing, what you said is very right, sir. A lot of people are quacks. Through our association, we have been talking about that don't go to quacks. People misuse it. This is a very common and it's a bad part in our nation. I think we have lost in Hindi, we call as that Sabhyata, Sanskriti, Swabhiman. We have lost it. So I know all of you have lived in that, but the coming generation is, to be honest, I always look into more of a materialistic than a man-to-man connection. Yes, we will definitely try to look into, but my submission to all of you is that in case if you have certain connection, please raise your voice, right? Raise your voice wherever you can down. It will be helpful, not for you, but people like me when I become leader.
Thank you for that response, sir.
Thank
In fact, there is one
Manjunath here. Hello.
Sir.
Hello.
Yeah, tell me, sir. Tell me, Manjunath, sir.
Actually, I differ from what Mr. Murthy had said, that annual health checkup does not include hearing problem. No, it is not true. Today only I got my health checkup done in Anand Diagnostics. Audiometry is one of the points covered in that.
You are fortunate, sir. That's all I can say.
Let us help in.
You are fortunate. Sir, Chandrasekhar, sir, you wanted to raise some questions?
Yeah. Yes.
Please.
Thank you, Doctor, for having even a very interesting session. My point is that will the wax accumulation affect the hearing quality?
Sir, it does, sir. It is at a lower level, but it has an impact, sir. Provided it is a long impacted wax.
Oh.
It affects. So that's what we say. When you go for an annual or something like that, it can be removed. Definitely, it can avoid certain times. It is better to get it cleansed.
Thank you, Doctor. Thank you.
Sir, one person has raised one doubt. Please tell where testing can be done in UP, Uttar Pradesh.
Sir, Uttar Pradesh, where, sir? Kaun si jagah mein, sir?
He has raised a question only in the chat box.
Sir, Uttar Pradesh mein, if you can tell which part, Lucknow. Okay, sir, you just leave a text to me. I will respond to I will send you one, I will connect you with one of my colleagues. I will connect you, sir. Leave a text to me, sir. Just tell me which place you want. I will connect it to you. And sir, our website is there, ishaindia.org.in.
ishaindia.org.in.
I'll read it. I'll write it, sir.
IAISHA.
No, sir. Isha is ISHA, ishaindia.org.in. This is our Association of Speech and Hearing People, where details are provided in which part of the India where speech pathologists and audiologists are available. But you can send me a text also. I will try to connect with you to the best who can help you.
It's again nice of you, sir. Again nice of you.
Okay. It will be my honor.
Yeah. This is one of the important take-home points in this meeting, sir. That help is available. There are people willing to help, and we need to only tap the source and get the help. That's something great, sir.
100%, sir. I'll try my best.
Yes, something great. Sir, any other person, any other doubts? Because already we are running, I mean, doctor must be, I mean, Goswami sir.
No, sir. You can ask, sir. I have lots of time. I don't have anything.
No, is there a way that we can avoid accumulation of wax?
No, sir. It is a normal phenomenon.
Okay. So to get the wax clean, we should go to a registered.
Wax should be there. It protects you also.
Okay. Okay.
Whatever God has given a system, all is required. Anything in excess is a problem.
Yes, yes.
There is a famous proverb in India that people in India die either because of overeating or undereating. So similarly, that everything has to be balanced.
Yes, that's right. Very correctly put.
Sir, we are running out of time, so we can conclude, right, sir?
1 second, ma'am. 1 second.
Okay.
If there is no other question, I think can we conclude? If there is no other question, I can hand you back to our NIMHANS team, who have been doing an excellent job in these kinds of webinars. So, I mean, I think we can, sir, with Goswami sir's permission, I will hand you back to the, to the studio, sir. Our studio at NIMHANS.
Namaste to all.
Thank you very much, sir. See, it was a very interesting experience for all of us, and we have got so many take-home points with us. With me, I can only wish, may God bless you. That's all, sir. Thank you
very much, sir.
Thank you very much.
All of you.
Thank you.
Okay, sir. Stay healthy, sir. Always.
Yeah. Lima, ma'am, you can take over.
Yeah, okay, sir. Thank you, Jambunathan sir, for moderating the session very beautifully. And I would like to thank Professor P Goswami for the enriching and informative session for us. And I would like to thank all the Zoom participants for joining us with us today. With that, I would like to thank all our partners, Government of Karnataka, Indian Psychiatric Society Karnataka Chapter, Karnataka Legal Service Authority, Bangalore Apartment Federation, Happy 60 Plus, Samadhana Counseling Center, REC Foundation, and Icon Life Sciences NSC Foundation. Once again, thank you all. Have a good evening. Thank you all.
Thank you.
Thank you. Goodbye. Goodbye. Goodbye.